Okay. Well, good morning, everyone. Thank you for taking the time to join us today to talk about our contracted services redesign analysis report. My name is Katie Gordon. I'm with Public Consulting Group. We'll do a little bit of an intro of ourselves in a few minutes, but first I'll kick it over to Maria, who will do a quick introduction of overview of the project and kick us off.
Thank you, Katie. Good afternoon, everyone. Nope, it's morning still. Good morning, everyone. My name is Maria Zablowski. I'm a director here at DCYF, and I'm getting some feedback.
Yeah, if you could make sure if you're not talking, make sure you are muted.
Lovely.
There we go. Thank you.
So again, my name is Maria Zablowski. I'm a director here at DCYF, and I hoped to sponsor this project.
Hi.
So this project originated from an executive leadership review and the decision to assess how services are contracted here at DCYF across the state. We recognize that, contracted services were being managed and delivered in different ways, depending on the service line, the population being served, as well as the region where the service was being provided. To improve the framework for delivering said services, DCYF partnered with Public Consulting Group, who's here to talk with you this morning. We understood that listening to those closest to the work was essential for making meaningful improvements. Listening sessions were held to gather input from individuals who both receive, provide, manage, as well as refer children, youth, and families to contracted services. Many of you today probably participated in a listening session, so we're happy to have you here. These sessions included specific discussions also with tribal communities facilitated by the Office of Tribal Relations as well. So today, Public Consulting Group will provide an overview of the project, share their findings, and then they're going to present some key recommendations that they have identified that have the greatest potential for positive impact, which will be shared with DCYF executive leaders in the coming weeks. So DCYF will ensure that the recommendations align with our current agency priorities, and obviously that the resources can be prioritized for implementation, considering the current budget environment that Washington State is facing today. So on behalf of the DCYF and PCG project teams, I want to thank you all for taking the time to join us today, and I will pass it back off to you, Katie.
All right. Thanks, Maria. Appreciate it. All right, there we go. All right, so here on the screen, you see the folks that were a member of the DCYF project team. There's 7 folks listed there. And on the right, you'll see the PCG project team. We'll get to this in just a moment, but our PCG folks, we all have real world experience. We're subject matter experts in child welfare and juvenile justice. And as you can see on the left, we had a wide variety of folks from DCYF managing this scope of work that started about a year ago. So here's how we're going to spend our time today. We have an hour with you. We did a little bit of introductions. So next we're going to do a high level overview of the contracted services framework redesign project itself. Then we'll walk you through the key recommendations that came from the project and a quick win, what the recommendation is, why we made it, and some considerations for implementation. And then from there, we'll do a Q&A. So in the meantime, please use the chat feature in Teams if you have questions while we're talking, and we'll respond in writing. And then we'll kind of pause at the end there, and then we'll do a Q&A portion where we'll open it up for comments if folks want to raise their hands. All right, so quickly, who is Public Consulting Group, and what do we do? PCG, we've been around for about 40 years, and we're a national leading management consulting firm. Then we focus mainly on public sector solutions in both implementation and operations. We mostly work with state and local health, education, and human services agencies, such as DCYF. More specifically, this scope of work is in our human services practice area that you see at the bottom of the screen there. And that practice area is a team of hundreds of professionals with real world experience in the topic areas that you see in those different colors on the screen. And to drill it down one more level, the PCG project team that I just flashed on the screen before, are working on the project, we specifically work in child welfare and juvenile justice on a day-to-day with clients all across the country on a variety of topics. All right. So just a reminder to folks, if you could mute if you were not talking, that would be great. Thank you. All right, so overall, DCYF's Partnership Prevention and Services Division, as Maria said, is leading a service delivery array redesign and analysis effort. In March of last year, so about a year ago, DCYF contracted with PCG to conduct an analysis of DCYF's service delivery array for children, youth, and families in child welfare, and also youth transitioning from the juvenile rehabilitation system. We'll speak a little bit more about that, the details of how we conducted our work when we get to our methodology section. But overall, the purpose of the project is to support the development of a framework that meets DCYF's intended goals for service delivery. Here on the screen, you can see 10 different service lines. And the review that we did included these 10 service lines, no more, no less, right? So I'll leave these on the screen for a moment so you can see, but a variety there: combined in-home services, independent living, network administrator, juvenile rehabilitation transition services, among more. All right, so what did we do? Our approach to this work, to get to our recommendations, we took 3 activities on. Number 1, we did a review of DCYF's contracts for those 10 service lines I just on the screen there. We looked at utilization for those 10 service lines as well. We also conducted national research on national practices for contracting across the country. What do other states and what do other jurisdictions do to procure services? And lastly, we did a large effort of community engagement and outreach to actually talk to the folks that do the work right across the state and get your opinion on how we can improve. So we eventually broke these activities down into 2 different phases of work. Here you see phase 1. Like I mentioned, we reviewed existing contracts. We looked at reports and data provided by DCYF for those contracted services. Although home visiting and juvenile rehabilitation service contracts aren't managed by child welfare, the program staff, they were included in the review because youth and families involved with DCYF can access those services. We looked at things like contract requirements, performance and reporting, available data, the annual number of clients served, annual expenditures, and we looked at strategic planning documents and the logic model for implementing a performance-based contracting as mandated by the 2017 House Bill 1661. So in parallel, we took a look at Washington's contracts and policies. We also researched and reviewed national practices, as I just mentioned, for service array frameworks with a particular eye to effective payment methodologies and how other systems are capitalizing on various funding sources, particularly like FFPSA or Title IV-B, Title IV prevention, Medicaid, state general funds, and the best and promising practices on building service provision capacity. So that was phase 1. So we did that. And then we moved on to phase 2. In phase 2, we used a qualitative research approach to really dig into the experiences and perspectives of DCYF staff, of community partners such as yourselves, and tribal partners involved with the current contracting process for those 10 service lines. We talked to a lot of people. We spoke to service referrers, both internal and external to DCYF. We talked to service providers. We talked to contract managers. We also spoke to individuals who have actually received the services within the past 2 years. In total, we spoke to about 200 people, and we had 32 different engagement sessions, as you can see on the screen. And we started the list with a few topics for discussion. We talked about communication and input, as you see on the right side there. We talked about service offerings, service delivery, and cultural responsiveness. And we'll get more into what we mean by each of those in our next section, when we talk about the themes of, we talked to all these people, what did we hear? What were the themes of what we heard? And for that, I'm going to pass it over to Sarah Sparks from our PCG project team.
Okay, so let's dig into some themes. So following the engagement sessions, we performed a qualitative analysis of notes and identified themes during our conversations, which I think you can assume took a very long time considering we talked to hundreds of folks. So folks shared lots of information, had lots of perspectives and insights, and we tried to take that information and compile it into themes across those topics that we discussed during the sessions. So we've grouped those topics, and in the PowerPoint, you will see there's going to be lots of information on the next few slides. I'm not going to go over every single point, but I am going to touch on some areas. So our first topic area was communication. So the category of communication is regarding the exchange and receipt of information with DCYF. And within this area, we heard about variations and inconsistencies in practice due to lack of standard processes and procedures. There being interpretations of contracts that vary, and those varying interpretations being applied differently. And then meeting cadences varying by service and region, and a limited ability for those to provide feedback and receive information back to them regarding that feedback that was provided. Again, I'm not going to read every single thing that's on the slide, but I am going to try to touch on high level. So our next area was service offerings. So service offerings is the category of regarding the range of services, availability, how service needs are identified, and service gaps. And within this topic area, we heard about the need for a mechanism to pay for service availability, service availability and capacity not being equal across the state. There needing to be an increased focus on meeting families' basic needs. And under this topic, we also include lack of transportation, which we know greatly affects reunification efforts. And lastly, one of the areas that came up or folks reported on under service offerings was service gaps. So participants highlighted the services they believe were lacking in the current offerings. And that list of those services that were shared are provided within our full report, which will be available online.
I should have added Sarah.
Online.
We put it in the chat. I failed to mention that at the top of the hour. The link to the full report is in the chat.
So our next topic area was delivering services. And under services, delivering services, it's regarding the execution and delivery of services and any barriers to offering and receiving services. So here we heard about caseworkers' need for more knowledge about services and materials that explain those services. So there are some in existence, but just more access to information and knowledge about services that are contracted. We heard about the referral process, both for community-based services, so those Medicaid services, and DCYF contracted services being complicated, time-consuming, just hard to navigate. And then service availability and capacity not being equal statewide. And you can see there are some overlap in themes that we captured under multiple topic areas, including this availability and capacity not being equal statewide. Our next area is cultural responsiveness. So cultural responsiveness is regarding the ability to build, provide, and receive culturally responsive services that meet the needs of individuals and families served. So under this topic area, we heard there's a need to incentivize providers to build capacity to address diverse needs, especially in those rural areas. There was a reported perceived bias of fathers, a need for more bilingual providers, and a limited capacity of providers who are able to meet the diverse needs of families. I'd also like to note that participants asked to identify training gaps that existed. So we put that under cultural responsiveness. And again, similar to those service gaps, you can find the list of training topics that individuals shared, both within workforce for both internally and externally. So those internal DCYF staff training needs, and then external providers and partners. And our last, so you may connect the dots that we said there were 4 topic areas, yet I have 5 here that I'm sharing. So what happened is after the sessions concluded and the notes were synthesized, We really noted that the topic of payment and service administration were frequently mentioned. So as a result of that, we created this new separate section called contracting infrastructure. And under this topic area, we heard that there's no standard operating procedures or written guidance, or a lack of those standard operating procedures and written guidance for contract managers, and just a lack of standardized contracting processes. And then providers and service referrers experience confusion due to those inconsistencies, and that contract requirements are interpreted in varying ways. Okay, that's the end of our theme section. Again, if you're interested to dig in these a bit further, you can refer to the full report, which is now available on the DCYF website. And now I'm going to pass it over to Sarah, who's going to start digging into our recommendations.
Thanks, Sarah. So we took all of that information that Sarah articulated in those identified themes and really use that information to come up with recommendations for how DCYF could move forward with the information we were provided. We broke the recommendations down into different categories, really identifying what could be the biggest impact for the citizens of the state of Washington, identifying a quick win that really would be low risk but high effort, or low risk and low effort but high reward if they went ahead and impacted this. And then there's an additional list of supporting recommendations that we will that you will see in the report if you have time to go through and read that. So what we're going to talk about now are the biggest impact recommendations. We identified 4 as the biggest impact to start with. The first one being to prioritize meeting the concrete needs of families when concurrently implementing supportive services. So really looking at what they need first. Developing and increasing the knowledge of services, the contracting process, not only internally but externally as well, and really creating a standard operating procedure, doing some additional training as Sarah had articulated in one of the themes, reference materials, and then communication practices, not only internally for DCYF staff, but really for all of the community partners that work with the contracts. Providing targeted incentives for providers in the rural and remote areas, really looking at those specialized populations and how to create contracts that incentivize contracts in those more challenging areas that are oftenly underserved. And then the last biggest impact recommendation that we identified is creating a standardized payment structure to enhance provider engagement, really recognizing that there is always room to enhance service quality and address those behavioral health and service coordination challenges for the families that are working with DCYF. So in the report, and as we dive in deeper here, you'll see in each key recommendation, we're giving some foundation as to why this recommendation was made, and then highlighting some implementation considerations. This by no means is an exhaustive list of implementation considerations. It really is intended to be some front of mind things to keep for DCYF to be aware of as they approach the implementation of the recommendations from the report. So recommendation 1, when we talk about meeting the prioritizing meeting the immediate and concrete needs of families, we really heard from all the folks that we talked to or that we heard from that it is hard to think about implementing services when your families are struggling to meet basic needs such as housing, food, electricity. We heard a lot about transportation and really those essential needs to handle their day-to-day. And caseworkers are struggling with how to make service referrals when the true issue may fall into one of these other concrete needs. Some of the implementation considerations for this really focused on having a basic needs assessment and process for families. focusing on training and having a practical guide for DCYF staff. Again, as Sarah had mentioned, really doing some specialized training for staff to minimize any unconscious bias that may exist, falling into stereotypes or negative attitudes related to the families that are served across the state of Washington. And then really sharing the process to deliver services, concrete supports to families, and any other related trainings. Really heard a lot from the folks that we talked to about training that's needed and additional support. And then finally, we listed the need to do an analysis to find any underlying challenges or barriers for families that might impact their ability to access concrete needs. Recommendation number 2 was to increase the knowledge of services and contracting practices by creating a standard operating procedure. We absolutely heard that there is a need to increase the access to guidance and training materials in the contracting process. The contract managers need some more specialized training. They really want to make sure that they're looking at contracts the same way from the east side to the west side of the state. They really would like some supportive guidance and referral resource documents on the referral process and information to the service array and delivery. And then partnering with community partners and tribes for more awareness of the contracting process. So just simply as it sounds, I say that tongue in cheek, knowing that creating an SOP is never simple, but developing a standard operating procedure guide and training for the contract managers when thinking about implementing this recommendation, developing some training documents on the referral process for contracted services, needs assessments, service array and delivery, really identifying some service experts within the DCYF staff who can help be the early learning navigators to support staff as they move through this process. And then reference materials, not only for internal, but external. And then what we have often seen be helpful in other states is having an FAQ, or that frequently asked questions document, so that folks who may be new to the process or have ongoing questions can have something to refer back to without having to rely on human communication, if that sometimes can be a hindrance. Third recommendation that we highlighted was the targeted incentives for both the rural and remote areas. This will come as no surprise to anyone who participated in our engagement efforts that there are definitely underserved areas within the state of Washington, and really how can providers meet the needs of families who may reside in those more rural or remote areas, and looking at some targeted incentives to really enhance the service array and accessibility to families without having to have significant impacts in terms of transportation, things like that. So the implementation considerations that we focused on really were to explore the opportunities for either startup grants or technology stipends, relocation assistance if you have providers who are willing to go and have offices in those more remote and rural areas. What would that look like from an incentive capacity? And then exploring incentives like wage pass-throughs, where service providers receive increased salaries or wages that are earmarked specifically for those remote and rural areas. And then reviewing the findings of the partnership prevention and services that there may be an over-reliance on translation services that may be a barrier to families engaging in services, and highlighting what opportunities there are. And then recommendation number 4, standardizing payment structures to enhance provider engagement, enhance service quality, and address behavioral health and service coordination challenges for DCYF staff. Our payment person, who is not here today, who really focuses on that, would want me to articulate that this does not mean, and it's the implementation consideration number 1, does not mean that all rates should be paid exactly the same way. But we heard that there is absolutely inconsistent payment methodologies across the different service providers. And so the current payment structures lead to inconsistencies that have an impact on engagement, quality, and administrative efficiency. So from an implementation consideration, we absolutely heard this as a recommendation and why it was one of our big four in terms of biggest impact. And so having the adoption of a methodology with exceptions to identify by understanding the differences between the different programs and service array. Enhancing the centralized rate development office within DCYF that do the oversight of payment methodologies. Sharing information on the rate methodology with those who are most impacted by it. Absolutely information we heard, and definitely something that DCYF should consider if they go to implement this recommendation. And then full access to SUD assessments and interagency planning groups. And then finally, the implementation consideration in terms of establishing a reimbursement structure for non-direct services like court attendance, report writing, meetings, and travel, things of that nature. So those were the big four that we identified. And then we also identified a quick win that really has low effort but high impact. And that was to create some enhanced bidirectional communication opportunities for DCYF staff and the contracted providers. We definitely heard loud and clear that there is area for improvement in communication, and there is some challenges in that there is a lot of top-down communication with minimal opportunity for any of that bottom-up communication. So there's not an opportunity to ask questions, get feedback, share data, and then get an answer to the questions that you may have asked. So for implementation, we identified that there could be a standard meeting cadence, structured agendas with core topics for every meeting based on a designated office. One of the things we absolutely heard is that this may be happening in some areas. It's not happening consistently across the service arrays that Katie had shared with you in the very beginning. So highlighting that there needs to be a consistent way to approach meetings. And protocols with a conscious effort to recognize there is regional, cultural, and tribal practices that should be considered as part of those communication opportunities and what that looks like from a unique standpoint that may exist within your service array delivery. Creating and processing a way to gather feedback. It's that closure of the feedback loop, as we like to talk about. So knowing that there is pockets of information that is able to be shared upward. What we often heard is that there's not really a response to the information that is shared. And so making sure that there is a way to not only gather the input, but also give a response to the input that's heard. And then having those standard agenda topics that relate to service delivery, what's going well, as well as some of the barriers that you're seeing. And then really closing that loop by sharing meeting notes, action items, and things after meetings are occurring. So now I'm going to pass it back to Katie, who's going to talk to you some more about the other recommendations.
All right. Thank you, Sarah. And I know we've been talking for a while, so we're going to wrap it up soon and we'll get to questions and comments from you all. So, but lastly, we wanted to share there are additional recommendations. And let me put those on the screen for you. So there are 11 additional ones. So in total, we had 16 recommendations that came from our approach, our efforts. And as Sarah mentioned, we narrowed those down to the top 4 key recommendations and a quick win. And that's not to say that the rest of them are unimportant or should not be considered, right, by DCYF. But, we had to prioritize some. So I'm not going to read these to you right now, but please take the time to go to the link that's in the chat to the final report, and you can see more detailed information on each of these. Okay. Sarah, if you could stop recording. Thank you, ma'am.